Hi, I'm Lauren O'Reilly. I'm a qualified pharmacist and your host of the Wellness Script podcast. Today's guest is Dr. Sonja Bobart. She is a GP and the founder of D4 Medical. She is a leading voice in preventative medicine and lifestyle medicine, and we're going to have a great conversation today about how you can empower yourself through your lifestyle to live a healthier and happier life. Here is my conversation with Sonja. Sonja, Dr. Sonja, it's great to have you on the Wellness Script podcast. I'm delighted to have you here. We're at the start of a new year. We're going to talk all things preventative medicine and lifestyle wellness today. So I suppose at the top of the podcast, what are some kind of simple ways that people could focus on prevention rather than cure this year?
That's a great question. And I think it's really important to talk about prevention, and a few reasons. One is prevention makes us more aware of our own health. It gives us a bit of autonomy. So therefore we might have motivation to kind of do a little bit more. Also makes us aware of things like risk factors. And I suppose when they've looked into prevention as a preventative, it actually decreases our costs long term, decrease our side effects long term of potential renal disease, hypertension, if we just get checked really regularly.
Yes. So we're thinking about, managing things before they become a problem. And yeah, exactly. Even from a cost perspective, that's major.
Absolutely. And I think that one of the simplest tasks you can do is even those things that are silent. So those silent diseases would be things like hypertension, so high blood pressure, things like diabetes, kidney disease. Always make sure you get your urine checked. Things like cholesterol, and knowing your genetic risk factors or your family's risk factors. And so you might avail of cancer screening maybe a little bit earlier, or just being aware of potential other screening things that you might do in terms of, your own family history.
So that's like kind of, would you say, a once a year thing for most people to do with their family doctor?
Yeah. And the whole thing is comparison. So knowing that trend of over years. So example, say someone at 50 always getting their PSA checked. And if the PSA jumps, say year on year, that is a time for intervention, because not everything has symptoms. And we know that with colorectal disease, breast disease, that really getting that kind of continuity of care with your GP is so important.
Okay, so that would be a full blood check. And what else kind of would people be expecting from their GP if they're not as proactive as you, Sonja? You're so good for promoting that with your patients. But if someone's trying to advocate for themselves, they'll want to get like a full medical, so they'll get a blood profile done and blood pressure. And
And I think everyone thinks, and I know myself as well, we kind of think maybe we'll do a health check when we're 40 for our 40th birthday. We'll do that executive checking. But screening probably starts from a young age. So we know in school that we might have dental checks, eyesight checks, during, I think, junior infants in first class. So that's a part of screening. And then usually in the teenage years, I suppose, female patients probably do come in a little bit more often than men in terms of screening, because maybe they might be wanting to start new medication, maybe for acne, etc. So getting your blood pressure checked, getting your heart and lungs checked. So you don't have to be asthmatic to get your lungs checked. But also knowing, especially if a teenager is, and now with the free contraception, making sure that you do get that blood pressure checked once a year. And also sexual health is so important, and it is free. sh.ie. It offers a free screening program for sexual health. So all teenagers should be doing that if they're sexually active. And then cervical screening starts around the age of 25. However, if you have any symptoms, kind of watery discharge, bloody discharge that's out of the ordinary, try and get that screening beforehand. And there are hospitals that will accept that screening. So just make sure when you're 25 that you're logging on to cervicalcheck.ie. And that's really the ages between 80 and maybe 18 and 39. Making sure around that age group as well that you're up to date with your flu vaccines. Flu vaccines are free up until the age of 18. However, if you've got risk factors, do continue them on. It doesn't have to be free not to get them. And then dental checks and eye checks. And then after 40, everyone probably should get their annual checkup. So to me, that would be starting from head to toe. So that includes, say in terms of looking at, say, your diet is really important, looking at your sleep, that's mental health. So much is supported with that. Making sure you look at your eyes, ears, cardiovascular system, your kidneys, so that's your urine check, abdominal system, if you've got any kind of gastrointestinal discomfort, neurological, rheumatological, but also don't forget your skin. Your skin is your biggest organ. And so really important to get your skin checked by Mo mapping. And a lot of the dermatologists will have computer generated Mo mapping so they can visualize what your skin is like over annually or maybe every second year. But any skin changes, get checked out. And then, of course, if you've got genetic risk factors or if you yourself have any symptoms at all, get that checked. And that includes breast for women and for men, because men do get breast cancer as well. And a testicular exam for men as well. That's really important for men to be checking their testes.
Yes. Okay. And I think that approach is quite different in the sense that, you're saying to get checked on the regular and have that baseline and that relationship as well with your GP. I know people, perhaps nowadays we move around a little bit more.
Yeah.
But if you have moved, to make sure that you have kind of as one of your priorities in your new home or whatever it might be, that you have got somebody that you're checking in with on an annual basis and who knows you at baseline. So therefore, something out of the ordinary relative to you, not just relative to the average population, is being picked up on.
Absolutely. Yeah. And actually, that's such a great point. Yeah. And I know a lot of our patients ask for their blood results or their general check or their notes. So if you are moving, even just get your bloods forwarded to you so that someone, another health professional can actually take a look at them and compare them to the others, because it's all about modifiable risks and decreasing that kind of risk factors.
Yes. And when we talk about risk factors, it's kind of one of the big things that I suppose comes up in lifestyle medicine and preventive medicine is the syndrome X or metabolic syndrome. And I suppose, could we just delve into what that is and how does that come up in a GP appointment for you, Sonja?
Yeah. And actually metabolic syndrome, I suppose, it's probably been out longer than I've been aware about it, but definitely. But it's really looking at a cluster of symptoms. So that cluster would be abdominal obesity. So that's increased girth around the abdominal area. Blood pressure. So that blood pressure being over 130/80, which might be surprising for a lot of people. Making sure that those HDLs, so if your HDLs, which is your good cholesterol, is low, that's also a risk factor.
Okay.
Your sugar level, so a fasting sugar level over 5.6, also a risk factor.
Okay.
And your cholesterol. So making sure that kind of making sure all those symptoms are actually seen as collectively, and making sure that when you are getting your health checkup that you get a fasting insulin level, because as we talked about earlier, your HbA1c is it's a great measurement of your blood sugar. That's blood sugar over 6 weeks. Whereas if you do a fasting insulin level, it's actually really probably quite important.
It's going to
reveal
show up
more.
there.
Yeah. Exactly.
First, yes. And actually very interesting that you said about the blood pressure being 130/80. I think that we kind of are waiting for signs and symptoms to be more worrying before we do anything about it. And even cholesterol and that kind of thing. There are the markers and the levels that are acceptable and normal and high. But if at baseline, okay, last year this is what my cholesterol level was and this year it's higher, even though it may not be concerning yet, it is indicative that there is a change in your body, whether it's due to aging or...
Exactly.
Yeah, so knowing those levels and having that, and knowing yourself as well. Your doctor might know, but getting the printout, even just if you go to the same doctor, it's nice to see, isn't it?
Yeah, I think so. Compare it.
Yeah.
Because we tend to kind of, in our surgery, we just give our patients all the blood tests and then compare them through. And sometimes, what we do, we look at all of them through time, as opposed to just that last level, but also the improvement. So I think especially we see a lot of women that are probably going through menopause, perimenopause, and their cholesterol does change.
Yeah.
But I think a lot of people focus on cholesterol, which is super important blood test to focus on, but also making sure knowing your sugar and triglycerides. So high triglycerides is another risk factor with metabolic syndrome as well.
Okay.
And so many reasons for high triglycerides, but so important just to know your numbers and advocate for yourself. So I know sometimes people come in and they might say, well, I've only ever gotten my vitamin D checked, but everything really should be checked at least once a year.
Well, you don't know what you don't know, isn't it? Until you check.
Yeah.
From a pharmacist's point of view, when it comes to staying on track with our wellness habits, consistency is usually the hardest part, especially when it comes to key aspects like hydration, energy, joint support, or even just winding down in the evening. When you're on the go, it can be really easy to let these slide. That's why I've been really interested in Irish-owned vitamin company and today's sponsor, Sona Vitamin's new effervescent range. It's designed to make daily support easier without adding another complicated step to your routine. It's also helping me stay on track with hydration goals as I add something really tasty and nutritious to my water. They have just launched their Electrolyte Sport Hydration Effervescent for rehydration and post-workout recovery. They have their Immune Triple Action for immune support, and then Joint Plan Effervescent to support comfortable movement, and my personal favourite, Magnesium 300 milligrams with vitamin B6. This is ideal in the evening when you're trying to unwind and ease those tired muscles. You'll find Sona's effervescent range in local pharmacies and select health stores nationwide or at sona.ie. Now, let's get back to the episode.
And on the topic, I suppose, of metabolic syndrome and, perhaps weight gain and being overweight or even obese, how are you seeing that manifest in your clinic as it relates to, we're hearing so much about Ozempic and the GLP-1, the weight loss medications that are coming up, and there's seems to be new ones coming up all the time. I think there's going to be a lot more in 2026 as well. Is that something that you prescribe, and how does that come up in your clinic?
Yeah, absolutely. Yeah. And I think the whole thing, and I know we're going to touch about this, never be embarrassed. Whatever you say to your GP in those four walls is between you and your GP. And they've heard it all before. Please don't be embarrassed. And please don't be embarrassed by advocating for yourself. Because I think if you feel, yes, I've done the lifestyle changes, I'm frustrated with the way I look, feel, I'm doing my hiking, doing etc., but I'm just not getting that weight down. Why not? Why not give you a little bit of a kickstart is one, but also we know those kind of long-term trials with things with the GLP and the GIP agonists, that they actually help to decrease the risk of vascular disease, help to decrease fatty liver disease, and as we were just talking about, metabolic disease. So in the long run, even from a cost perspective, it actually, I know these drugs are, they are expensive, but in the long run, those kind of sequelae of having metabolic disease, cardiovascular disease for that length of period far, far, far outweighs the cost of the Ozempic, so the tirzepatide.
Yes.
Really, I think those medications work. Obviously, they're not given to everybody.
Of course.
There's certain criteria.
Yes.
But I think more and more, and I think it's in Ireland, it's been out in Southern Ireland, February of 2025. And we would probably prescribe a lot of that compared to Ozempic in the past because of, Ozempic is mainly for the type 2 diabetic, but also for adipose tissue, the tirzepatide is it really very, very effective.
Yes. Okay. So that's kind of the way that it's going now. Ozempic was kind of discovered as a side effect, really, wasn't it?
Absolutely, the semaglutide.
Whereas these are being designed with weight loss specifically in mind.
Yeah, exactly, because it's got that GIP agonist as well, which helps to increase your insulin. So then that gobbles up your sugar and your carbohydrates, and that makes us feel a little bit fuller. Okay. If you're feeling a little bit fuller, therefore that food noise, because it is sometimes a problem with people is that food noise, and it certainly decreases that. But also new studies have shown it actually decreases our desire for alcohol as well.
Wow.
So people have noticed that because it works on those GABA receptors, people are drinking far less. If not, they're not drinking at all.
They don't care for a drink anymore.
They don't care for a drink. So, and they can't tolerate it. So actually it's really very effective.
Because that's a source of calories, of course, as well.
Source of calories. Yeah. I should also say, of course, if you're on this type of medication, because it's potentially going to affect the liver, you shouldn't be drinking at all.
Yes.
But certainly
there isn't a want to anyway.
Exactly.
Right.
The desire actually is diminished considerably. So it's really very effective.
Okay. And with these medications, are they kind of prescribed with a view to getting someone over the hill, over the hump of this, I suppose, feedback cycle of I don't feel I can get out of this cycle? And then is it that they'd be deprescribed then after a certain period when certain goals are met? Or
I suppose the way we prescribe it, and probably other companies would do as well.
Yeah.
We prescribe it. You'd have a great consultation with your patient. Make sure that you do those baseline blood tests, and then we really know what we have to focus on. So that probably is like a high ferritin, high cholesterol, high triglycerides, possibly high blood pressure, high sugar / insulin. So after that, then it's really seeing what the kind of future is. So what are the expectations? So those patients that are prescribed these type of medications should be followed up every 4 weeks.
Okay.
Not necessarily doing bloods every 4 weeks. I tend to do them every 3 months, but that progress between the first consultation and the 3 months is huge. But also I think the fact that there's might be maybe a 20-pound weight loss, that kind of incentivizes people to maintain that weight loss. But obviously that medication can't be done for a month. It's more of a long-term type of medication. So 18 months would be the average.
Okay.
And then it could be weaned down depending on, but I know people that prior had been on Ozempic, they mightn't take Ozempic weekly. They might probably take it every kind of 10 days to 2 weeks, just for that maintenance of decreasing that insulin level.
Okay.
Or, the glucose level. So I think once people know this is not a short-term prescribed medication, is more longer term, that's fine. But the whole thing is making sure that they're supported with a dietitian, possibly physiotherapy, but with an exercise program, which a lot of people would do through their gyms or through their physiotherapists. But, I certainly think that in terms of when people see that progress with their blood pressure or cholesterol, it really does have a positive effect. And we know long term that's going to have a positive effect on cardiovascular outcomes.
Yes. And I think the key as well is what you said, is that they're not being prescribed willy-nilly. There is a huge amount of criteria that have to be fulfilled.
Yes.
And regular checks made that, if somebody is starting one of these weight loss medications, that they're being checked on a really regular basis. If there is a concern around side effects, then that's being monitored regularly as well. And I suppose it's always about benefit versus risk, right? That if the benefits are outweighing the risks, and if it's all relative. So I suppose if somebody is kind of thinking about what might be right for them, just kind of having that really in-depth conversation is gonna.
Absolutely. And as you said, it's not for everyone. So someone with a family with a personal history of pancreatitis, thyroid cancer, kind of slow gut motility, they would all be kind of contraindicated.
Yes.
Or even a prior history of an eating disorder.
Yes.
They really would be contraindicated. Whereas someone with a BMI over 27 with risk factors, or over 30, or genetic predisposition, certainly I think they should be advocating for one of the GLPs.
Yeah. Okay. That's great, because it can be hard for people to A, broach the topic, and as you said, not to be embarrassed, and B, to kind of make that step. It's not obviously for some people it might just be lifestyle measures are great for them, but to know that there are options and available to you, and that if it is the right option for you, not to be ashamed about that, because there's a lot of stigma and chat as well. So it's nice to know that there's options available, and whatever's right for you in that private consultation with your doctor. No one needs to know your business.
Absolutely.
Just to know that you can have that conversation, and the outcome might be, actually, no, I don't want to do that, and that's fine. So you could, but just you can bring it up. And you mentioned gut motility, makes me think of the gut itself, and I suppose it does connect in, especially at this time of year. We might have had a busy festive season in December and feeling the effects in our gut. So to you, I suppose, what does good gut health look like, Dr. Sonja?
And I love that question, because I love this quote. So Hippocrates said that all disease begins in the gut. And which is interesting, because actually it is true. Okay. So someone that if someone did have a bad, unhealthy gut or a healthy gut, basically they have a huge diversity in terms of their gut. They might be having proper bowel motions, whether it's regular for you, it's daily, or every second day is absolutely normal. Their digestion and their absorption of nutrients are efficient, because we know that the gut is really important in terms of digestion, in terms of your immune health, our endocrine system. So all of that is really important in terms of gut health. So the other thing is that sometimes when the gut goes a little bit askew, for whether it's from people traveling, people kind of, being on antibiotics, etc., what happens is that people might get a little bit bloated, a little bit more bowel sounds. They might just feel sluggish, or their energy levels might be a little bit poor. So we know then, well, that's your gut talking to you, saying, okay, there's something up. So your gut actually is probably the basis for all health.
Yes, and the messages that it's sending you in the form of symptoms are what you need to pay attention to.
Exactly, yeah. I find a lot of people, like, before your pharmacy exam, before my med school exams, oh yes, that gut was talking to me.
Absolutely. It's the first thing, like I used to be crippled. Like I remember during my leaving cert, I remember I ended up on the floor like with cramps of like just so much pain. And my mum had to go up to me, a hot water bottle, peppermint tea, before it eventually calmed down. And probably what actually helped was just I stopped studying for about an hour because I couldn't actually physically do it, that kind of pressure is just crazy. And if we're doing that all the time and we just accept the fact that, oh, I just have a bad gut, well, actually, why is it like that?
Absolutely. And I think that's another, and I know this is a different topic.
Yeah.
More and more, actually, I was just saying that today, we're seeing a lot of young women with endometriosis.
Okay.
So and we know that probiotics probably can really help with endometriosis.
Wow.
But if your gut is in dysbiosis, you're going to increase up your inflammatory markers.
Yes.
Your inflammatory markers are going to cause more inflammation within not only your gut, and you get a leaky gut, but also with your pelvic system as well. So with your whole gynecological system. So it kind of features into every single aspect of our organs in our life.
Wow. So it's looking at the whole kind of inflammatory picture, with PCOS being inflammatory.
Yeah.
Also the gut being, if it's angry, or if there's a lot going on, that's also going to be inflamed. So overall, we want to do things that are going to kind of help
relax our gut.
Yeah. Okay. So when people come to you with gut problems, like how do you differentiate between something that's maybe acute versus something that's as in short term, or something that's like a chronic condition?
I love that question because I love a good diary.
Yes. Oh yeah. Okay.
So I
great.
normally would get people to actually just do a diary of when their symptoms occur. Could it be when they started that new job, when they were doing their leaving cert? Did it kind of settle during their summertime? Weekend is a great one, because during the week people have really stressful jobs, so much pressure, so much on them, and then the weekends tend to be a little bit better. So if that's kind of cyclical change, then it's kind of highlighted, okay, this is possibly stress induced.
Okay.
I love a good probiotic as well.
Yes.
I would tell people absolutely make sure you have your pre and your probiotics.
Okay.
Make sure you diversify your diet as much as you can. And I think a lot of the time people mightn't realize, if all of a sudden I start eating kimchi, my gut is going to be calling out to me, for weeks. But that is true, because it's actually, if you think it's kind of healing the gut, so do things slowly.
Yes, introduce new things like that, the fermented foods slowly.
Really slowly, because that's really good. So food first always.
Yes.
And then there are loads of probiotics out available.
Yeah.
And by all means, not everyone needs every one of them.
Yes.
But I think pick one that actually you think that will work for you. There's loads of amazing brands out there.
And it's specific to your concern, I suppose.
Exactly, because you've got your lactobacillus, your bifosporidium, you've got so many different types. And make sure that CFU, that colony of forming count, is huge, that it's diversified, and you've got, I think it's 10 to 20 billion of your CFU colony units. So make sure it's hugely diverse, so it actually gets into your gut. Yes. Make sure it's diverse as well. So I think looking out for things like that actually will help you in the long run. Yeah. And it's not going to work in 2 days. It's going to probably get worse before it gets better. But certainly I think all the data shows it really helps inflammatory markers. It helps things like inflammatory conditions such as psoriasis, endometriosis, fibromyalgia, which people don't, that is certainly contributes to it. So, I think probiotics and prebiotics are incredible.
Yeah, wow.
And evidence-based.
Yes, and when they span so many different areas when you're taking the right kind of one for your concern. But I suppose the key, I suppose one thing that comes up with probiotics, it's not about just take, like in general, like I'm going to take one for my wellness. I don't have any particular concern in mind. You probably won't notice benefit then because you don't really need it.
Yeah.
But if you do have one in mind, then it could be beneficial if you're taking the right one.
Exactly.
And on supplements in general, how is that's something I know you're very proactive with lifestyle. So I'd imagine that comes up in clinic for you. Is that always in response to bloods, kind of, or
yeah? And I suppose with supplements, and it's always food first.
Yes.
But there are different times where we need supplements. So the first one would be age. So babies that are born, I know everyone needs vitamin D, but certainly babies that are born are supplemented with vitamin D. So, and the elderly mightn't have, as we're talking about, a huge diversity of diets. So they probably don't get enough nutrition. So their diet might be very structured.
Okay.
So certainly that's definitely, age is definitely important. Gender. So sometimes women might need an iron supplement maybe during their menses. Men might need vitamin D or something different.
Okay.
So it can be gender specific.
And only during that time of the month potentially?
Depending on their blood test.
Yes.
And then I suppose in terms of different times of your life, so pregnant women will need folic acid, but actually I think everybody needs folic acid, but they might need a little bit more than that in terms of pregnancy.
It's hard to get enough from the diet, or
especially folic acid, isn't it? The methylated folate. And then the other aspects would be if someone has a restrictive diet. So a lot of teenagers, and this is probably going back to the probiotics, we start our probiotic journey from birth. And, when we're born through a vaginal delivery, we're being exposed to probiotics. Adolescents, and I have a few adolescent children at home, and their diet might not be, they're in Tesco buying jellies, and which is fine.
Yeah.
But really diversifying their diet is really what we encourage to help with their gut.
Yes.
But also their nutrition mightn't be as great, so they might need something else.
Yeah.
And also people with malabsorption problems, again, celiac, ulcerative colitis, do have to be careful in terms of probiotics, but they probably need supplementation with maybe vitamin B12, maybe iron, and maybe folate as well.
Yeah.
And everyone probably needs vitamin D.
Yes. And I suppose the thing as well is not to let yourself get deficient. And we're not just preventing deficiency, but also optimizing for better health as well, isn't it?
Yeah, that's a good point.
Yeah. And Dr. Sonja, I saw one of your posts recently about something that we don't focus on enough, which is our eye health. And you mentioned some supplements there as well. Could you kind of share more about that? Yeah.
I suppose, so as we reach over 40, we're at risk of, most men and women will be presbyopic. So you see it if you're going out for dinner. So everyone over 40 is with their little reading glasses that they sell at Penneys or Tesco's. Absolutely fine.
Yes.
But we think, okay, that's an aging process. But what else is happening with our eyes? So it's really important that we get our eyes checked. And also things like macular degeneration, which is sunlight induced. Investing in really good sunglasses is so important. But things like ocuvite lutein, Actase is the one I particularly take. Yeah. They help that oxidate, they assist with your eye health and decrease your risk of macular degeneration, because that again is a progressive disease that can lead to blindness. More common in women than men, more common in menopausal women actually. So it's really important to make sure you're supplementing for your eyes, and that's a good point.
Yeah, it's something I became aware of when I had laser eye surgery, is that my eyes were so dry. So I was taking an omega-3 supplement, and it really, really helped with the lubrication of my eye and the dryness, which is interesting because it's coming from the inside. You think you need your eye drops, but it really made a massive difference. Especially when I woke up, I was like, oh,
I can. Omegas are amazing, aren't they? There's so many benefits of omegas.
Yes, and even though we're an island, we probably don't consume enough oily fish, so it's great to have something available. And also people are follow a vegan diet or whatever it might be. So for different reasons, we might not be getting enough through our food first approach. So it is important to kind of, with any supplement, recognize, I guess, like that, this is the gap that I have and I need to kind of get it from somewhere. Exactly. And I think that kind of connects in with women's health in particular as well, because you are great for sharing well, I don't like to say atypical symptoms of cardiovascular disease because women are 51% of the population. So it's not atypical to be a woman with woman-specific symptoms of cardiovascular disease or of heart attack or, you know, different really serious kind of issues as it relates to women's health. So I suppose, how is that something that you have a meno clinic, like a women's health clinic within your practice? So does that come up from mostly a proactive approach from you, or do women come to you with like, I'm so concerned about cardiovascular health, it's something that runs in my family?
I think a bit of both. I definitely think in the last, I think since COVID, you know, maybe it's probably social media as well. People do talk, I think because we were all faced with the situation that we didn't know the future of. And I think the other thing is that for maybe 2 years, men and women's health was probably ignored because it was either COVID or not COVID. That was kind of, you know, the category. So I think people are definitely very proactive in terms of their health. A lot of people are, you know, since 1996, there's less smokers in Ireland. You know, thank you, Miall Martin. You know, there's so many proactive things that people do. And now with free HRT, absolutely. I think people are definitely proactive. Cardiovascular disease, I think women are definitely kind of thinking, okay, my blood pressure is that, but what's my cholesterol? How much am I exercising? I definitely don't smoke. I don't like people smoking around me. So I do think that people are definitely thinking more of the future. And also a woman in their 40s and 50s are probably, if they're lucky, looking after their parents. And they're seeing that future. And hopefully the future is not grim. And so I do think, to answer your question, we're probably a little bit more proactive than we were, say, 15 years ago. Because we're that next generation.
Exactly. And it probably, I would imagine, comes up given the age kind of profile, as you said, earlier on with the age 40 screening annually, but also that coinciding with the incidence of perimenopause, entering that kind of phase of life. What does that kind of consultation look like, Sonja, when it comes to someone who thinks they might possibly be entering that phase of life, you know?
And it's funny because a lot of people probably are on it and they're like, well, but a really interesting one recently that you might have seen is that sometimes women a year or two before perimenopause or during perimenopause, they start complaining of joint pains. So specifically something like a frozen shoulder or adhesive capsulitis. And that's actually one of the atypical signs of perimenopause, which is so interesting. But a lot of the time women probably come in and they're like, I'm just not as sharp as I was. So you get those physical, psychological and genitourinary symptoms. Usually, you know, perimenopause can last up to 7 years. So it's kind of late 30s to mid 40s that, you know, we should really be on it, you know, in terms of, okay, those are a multitude of symptoms. Could it be this? And yes, I know a lot of people will say, well, bloods don't really mark it. But as you and I were talking a lot, I mean, we have seen people with thyroid disease or celiac. So their iron count and their B12 was so low. That's why they were feeling so poorly. So blood tests are really important to kind of rule everything else out, you know, and compare it, as we said, to previous bloods. But I think, and also it's a great baseline. So we don't need that estrogen level to be less than 92 to prescribe HRT. And that's the other thing that came out of over the last 3 years. I think prior to that, women might have thought, well, I haven't stopped my period yet. I don't need to be on HRT. But there's a great study done about people that had a risk factor, had the gene for Alzheimer's, and they compared it to perimenopausal women. And perimenopausal women had more vascular compromise than people with a genetic predisposition to Alzheimer's.
Wow.
So although we're thinking, yes, physical symptoms, psychological symptoms, genitourinary, we also really do have to think about our vasculature, our decreasing our stroke and dementia risk, and of course our bone health.
Yes. Okay. So from that perspective, from a preventative medicine kind of point of view, if we're to tackle the perimenopause and the associated risk factors, does that look like adding in estrogen in the form of HRT or...
If a woman has no absolute relatively contraindications, absolutely HRT. And HRT is not, I know the HRT had a bad name in early 2000 because that that trial
study.
was so flawed, the WHI trial, and actually the whole statistics was completely wrong. And what we prescribe, which I know I have my little magic box
Yes.
there, is 17 beta estradiol. So 17 beta estradiol is that body identical estrogen and micronized progesterone, if in order to protect the womb, or a Mirena coil if needed, if they have the womb intact. So a lot of the time people think, okay, I'm going to have could I get breast cancer from HRT? And the answer is there's a marginally increased risk, but not a huge risk. We have to look at 95% of breast cancer is what, unfortunately, is our lifestyle. So it's stressors, it's our cortisol is being raised all the time. It's alcohol, it's obesity, it's smoking. So many factors that contribute to breast cancer versus just family history. So a trial of HRT for 3 months, and if it works, if life is better for you, if your sleep is better, that's going to decrease your cortisol levels, decrease your weight gain, because that's the other kind of thing that everyone thinks. Am I going to gain weight with estrogen, progesterone? Probably not, because you're just replacing what your body needs.
Yes.
It's like if you're iron deficient, you're going to take iron, similar, to that.
Yes, exactly. And I think, maybe we'll have a look at your
Yeah,
HRT box.
So that
here.
is, so our HRT box, so we know that it's all wrapped up.
For anyone who's listening on audio only, we'll describe what's going on here to you, because
so we know that Estradot, so Estradot is in the form of a patch. There is a generic version of this available now. Prior to that, it had been Estromom, but the patch is literally twice a week.
Okay.
It's very easy. Start off at 50 micrograms in most people, and you increase up with symptoms. It takes about 10 to 12 weeks to start to really make a difference.
Okay.
But if you've got a womb intact, then you should be on progesterone. So progesterone comes in a few different forms. The versions we have here is eutrogestrone, taken at night. Most women find this amazing for sleep. And they come in different doses, whether you're still bleeding or not.
Okay, that's what determines the dose, is if you're still... Okay.
Exactly.
Yes.
And then the Mirena coil, which is my favorite. So the Mirena coil is about 52 micrograms of progesterone. It works locally. It helps with healthy, painful periods, which happens usually during the perimenopausal time.
Yes.
It's also licensed for endometriosis.
Okay.
And it works locally on the uterus. So it's a great half of HRT.
Okay.
And it's contraception for those perimenopausal women who might not want that baby number 2 or 3.
Yes, absolutely. And for anyone who can see it there, it's not as big as it looks.
Exactly.
It's only the top part.
Yes, sorry. It's
Yes.
So it comes in a huge box, but that's really
which
just
is
the
scary.
introducer.
Whenever I dispense it, everyone's like, what is that?
God. Yeah. And literally it's just a tiny little coil that's inserted, and it's probably one of the smallest coils available.
There. Yeah.
So
it's not as kind of daunting as we might think, and once it's in, you can forget about it.
Exactly. So
which is
5
great.
years for HRTs, that's really important. If you're just using it for HRT, it's only 5 years license.
Okay.
And then 8 years for contraception.
Okay, yes. So different depending on the use case, then it's going to be reassessed.
Yeah.
I think that's really important. And it's actually great to highlight as well that it is contraception, because I've come across consultations where I've done an emergency contraception conversation with a woman, and we've done the whole consultation. Are you on any other medications? No, I'm not. And then they say, will this affect my coil? And I'm like, oh, you already have it. But they had it for HRT. So naturally you kind of categorize it as something different. But it's working away there as contraception, and the most effective one of the most effective forms, because it's no human error in terms of it's just staying put. So it's important to mention that as well.
And the procedure, that's the other thing I always say to people, that procedure takes literally 5 minutes to do.
Wow.
A little bit uncomfortable. Obviously you're given kind of pain relief beforehand.
Yes.
But it literally takes 5 minutes max.
Yes.
And then just make sure you're kind to yourself that day that you're doing it, and you just chill out. Netflix and chill.
Yes.
And then you're good to go.
Coil, Netflix, chill. That's the day. Yeah, perfect. No, I agree with you, because that's actually also important, because women will get something quite although it's only a 5-minute consultation, but it's quite, it's something important in your life. Be kind to yourself the rest of the day.
Because I know we fit them most afternoons, and people will go back to Zoom call. I'm like, no. We'll give you a note. You need to just chill out.
100%.
But the other two ones are the Linzetto, which is the spray, and then the Estrogel, which is the gel that you put on. These are daily formulations of 17-beta estrogel. They're both really popular.
Yes.
Especially the Linzetto because it just fits in your bag.
Yes, ideal. And they're alternatives then. And also a big issue that we've had, especially on the pharmacy side of things, is the availability. So
of the patch.
And you know that, I'm sure, so well.
Yeah.
So that it's great that there are alternative estrogen formulations available in terms of the spray and the pump that could be prescribed instead, should that happen again.
Exactly.
That's a whole other issue.
I know.
As to why they go short, we're often left in the dark around that, and we just have to work with what's available. But yeah, hopefully it will improve.
And then one thing I did want to say, which a lot of people, I always try and say, is that although someone's on HRT, or a systemic HRT, whether it's the patch, the spray, the gel, that won't help genital urinary syndrome. So it's really important that you might need topical estrogen, which is in the form of Vagifem. Invagis now I think it's gone off the market.
Yeah.
There's also Uvestin cream.
Yes.
But making sure that if you do have any symptoms of genital urinary syndrome, make sure that you're on your Vagifem.
Yes. Okay. So if you're someone who's experiencing vaginal dryness, urinary tract symptoms, that acts right where it is, locally in the vagina.
In the vagina. And even, and I know, I will say this, but even if someone says, yes, with intimacy, we've had to buy lubricant, that is the first sign that you need to be on Vagifem. So usually it's actually a lot younger than 40, 45, because any kind of change in those hormones, even women that are lactating, women that are on the pill, you might remember that's all a change in hormone. So they might need something like Vagifem, which is just localized. It's not going to affect you whatsoever. It's not systemic. So any change in those hormones that leads to dryness, ask for Vagifem.
Okay. So it's not necessarily someone who's
just
perimenopausal.
Oh, exactly.
Wow. Okay.
Yeah.
I think
so a lot of women on the pill, actually, because you're not ovulating.
Yes.
So therefore you're not getting that kind of progesterone surge and then down.
Yes.
So so the Vagifem does really make a difference.
Wow. Okay. That's really helpful to know. And I think maybe on that kind of same topic, slightly on women's health, when it comes to contraception as well, like there's so many myths around that as well, around like how long you might take it for and then coming off it. And something that I get asked about a lot is, if I've been on the pill for this long, or if I've had the coil in for this long, like, is it reversible, or could somebody become pregnant after that kind of time period? Is that something that you get asked a lot?
And I suppose now, compared to, say, I was having this conversation with friends over the weekend, compared to the 1990s, the pills that were out there, like the Femidines, etc., they were so strong compared to pills that are available now. But I think if someone is on the pill, just make sure it's the lightest pill that's doing its work.
Gotcha.
So whether you're on contraceptive pill for acne, whether you're on it for polycystic ovaries or just for purely contraception, just make sure it's the lightest pill that's doing its job. But there's so many other forms of contraception, and probably one of the most popular around where I work is the Kleina coil.
Right.
So the Kleina is 19.5 micrograms of progesterone, works locally, a lot smaller than the Mirena, really easy to insert. For some reason, no one finds it a problem whatsoever. Lasts 5 years, and once you remove that coil, your fertility is restored. So it's a great form of contraception, and probably the most popular.
And that could be used pre-childbirth, like if you've never had kids. Yeah,
absolutely. So once you need contraception in your relationship, think about the Kleina coil. If you're a type of person who prefers to take something every single day, the lowest possible combined pill for you. If you've got contraindications to estrogen, whether it's a migraine with aura, then something like the Cerazette pill, which is every day. But might as well get the Kleina in.
Yes, exactly. You don't have to think about it or forget it when you're going on holidays.
And it's free. Like it's a free, it's free insertion and free script.
One of the barriers to entry used to be the cost, because it was significantly more expensive than the pill. So now, thankfully, in Ireland anyway, they have removed that for a good portion of it, the age groups, and then
Yes.
and then as you go into it for HRT, it's covered then as well,
Yeah.
which is also good. There's a little gap in the middle that I hope they close in terms of age group and then going into perimenopause. So we'll get there, I hope, with that one as well. And I think from a more general perspective, Dr. Sonja, when it comes to going to a GP appointment, whether you're going about, your health screening or the menopause or anything else, how do you kind of get the most out of it? Like how could you prepare for a GP appointment? Maybe people feel nervous that they're going. Like you mentioned a diary before for good health, so things like that. Yeah.
I like that question a lot, because it is something that sometimes everyone's time is busy.
Yeah.
And everyone thinks, oh my gosh, I've got to get every single thing checked. And just remember, whatever you do, number one thing is nothing you say you should be ashamed of.
Okay.
That's the number one thing.
Yeah.
The second is write a list. And what I would say is, kind of prioritize what those first three, the most important things that you want to address then. If you feel I have such limited time, I've got to get back to work, I'm not allowed time off work, whatever, then book a double appointment ahead of time. So maybe sometimes just remember, when you're phoning a GP surgery, everything is confidential. So whatever you say to that medical secretary is not going to go back to anybody. It's within those walls.
Okay.
So if you say, well, listen, I want to get such and such screening, book a double appointment, because then everyone has time. Because most GP appointments are between 12 to 15 minutes.
Okay.
And so if you've got a list of 10 things, sometimes the really most important thing is dismissed. And that might be the thing that's, we call it the doorknob consultation. And that's not fair.
Yes.
That's not fair for that to be dismissed. So book a double consultation, and make sure, the other thing is, make sure that you know what your agenda is. So you want to know, okay, what do I want to get out of this? So say someone might say, okay, this is my only time for a smear. I need a smear done. So make sure that you know that. And at the end of the consultation, so when I suppose when anyone talks to anybody, like that in pharmacy, everyone just picks up a third of what you say, or remembers a third of what you say. So if you have time, just even jot things down on the phone saying, okay, I have to do this 3 times a day. I have to do that, I think that's really important, because then you can go back and say, okay, that is really important, because every single symptom is important. Sometimes they're all together, like say perimenopausal symptoms, but it's really important that you prioritize those 3 things. And then getting back to the diary, I love a diary. If you've got symptoms that have been really bothering you for say 6 weeks or more, make sure you do a diary, because it could be cyclical. It could be, there are many permutations to it. As we talked about, something like irritable bowel. So making sure that you do a diary is so important.
Okay. And your doctor doesn't mind. Like, I think people think, like, I don't know, that maybe I've heard people say, oh, they'll be looking at me like, well, who's this person coming in with their notebook? You probably love to see a notebook.
Absolutely,
because you know that person knows what they want to get out of the consultation. And I think the other thing that you touched on that I think is really important as well is when you tell the medical secretary, like, that is private also, like, because I think you might say, I want a double appointment, and they might ask why, but it's not to be nosy. It's because so they can relay the information to you. And if there's a smear that needs to be done, that you can be prepared for that. That you're not like, why is Lauren coming in to see me for half an hour? Like, I don't know. Whereas, I think that would be much more helpful for you to prepare.
I think so. And I think everyone's time is precious. So it's really important that double appointment, that you don't feel that it's rushed and that you didn't get out of it what you wanted to really get out of it.
Yes.
And maybe even if you don't have that 15 minutes, book an appointment maybe the following week or 2 weeks later to even go through maybe your bloods, or go through, how are you doing with the diary if you hadn't done a diary. So kind of booking a follow-up appointment, I think, is so important as well. Yes. Because only a third of the things that you say are you're going to remember.
Yes.
So
take your notes.
Take your notes. Like, people jotted it down on the phone, which is great.
Yes.
I can't do that because I'm phone. Well, but I write things down. Like, I think it's, but remember, nothing that you say will shock anybody.
No.
And whatever you say is confidential. It's not going to be discussed elsewhere.
No, absolutely not. And the same goes with your pharmacist. If you're in that consultation room, like, and then we'll always refer if it's something that needs to be referred on. But it is great to know that, like, as healthcare professionals, bring your notebook and tell us
Yeah.
everything that's going on. I think that's really useful. So I think in 2026, anybody who's listening will know, to get their health screening.
Yeah.
When you go to your doctor, make sure you know like what you want to cover and that you don't leave without covering it, but that you also give your doctor enough time, as they're only a human, to address those concerns. If you need 30 minutes to do that, then book that accordingly.
And don't let things fester.
Yes.
Because we all ruminate. Every single one of us ruminates. Oh my gosh, what is this? What is this? Book that appointment.
Yeah, I think and in an age of, AI and Google, we feel like we can kind of self-diagnose or self-treat, but like we can't. You can't like replicate. It can be helpful for minor ailments and things like that, and treating yourself for your cold and your flu, and like me today, I'm stuffed up. I'll be clearer in my future episodes, but yeah, I think it's really important to make sure that you are. The worst or the best thing that can happen is the doctor will say, you're fine, and what you showed me looks fine, and you're great. So I think it's always just good to have that space and the peace of mind that you're not stressing yourself over it as well. Thank you so much, Dr. Sonja. I feel like we got a full health MOT today.
Thank you so much for having me.
Thank you. And if anybody is looking for Dr. Sonja, you're a D4 Med GP on Instagram, and they can find you in your medical clinic, as well. And we will link everything down in the show notes below as well. So thank you so much, Dr. Sonja.
Thanks so much.
That's it for today's episode of The Wellness Script. If you enjoyed it, hit subscribe. It really helps us grow and keeps these evidence-based conversations coming with top experts to help you with your health and wellness. Follow us at Wellness Script Pod on Instagram and TikTok so you don't miss an episode or a live event. And a big thank you to Sona Vitamins, Ireland's longest established nutritional supplement producer, for supporting the show. Catch you next Wednesday with a brand new episode, your prescription for better living.